Hi, my name is Claire Murray, and in this presentation I'm going to be talking about the long-term care presentation that we had in class a few weeks ago. And the main point that I was able to take away from this was that you really have to have a love of people to work in this kind of career with long-term care patients, because you really will get to know them. And if you don't care for them, you're just not going to be able to do your job to the full potential that you need to, and you won't give the patients everything that they deserve either. And I would definitely consider this as a career option, just because I do love people, and I visited nursing homes multiple times in the past, and I've always enjoyed myself while I was there. I just don't know if I could do this as a full-time job. But this is a career that connects to CLM, because it's clearly in a hospital, or not hospital, healthcare setting, which is a huge part of clinical leadership and management. And the only difference is that older people or elderly people have much different needs than those in a typical hospital setting, because clearly they are older and have different healthcare conditions. Not being able to remember things is very common. I've had grandparents with that issue multiple times, and there's other things too that just comes along with old age that you won't experience in a hospital setting with kids or middle-aged adults. There's definitely pros and cons, though, to a career in long-term care, because I think it'd be cool to build relationships with the patients, but it would also be very hard to say goodbye, because obviously they're there for a reason. They're at the end of their life. And I just know that I would get attached, and I just don't know if I could deal with that in my everyday career and job. But it's also something that you would learn to understand and accept. But before I would consider a job in long-term care, I would definitely look at different aspects of healthcare, such as pharmaceuticals, companies with pharmaceuticals, or insurance, or a typical hospital, before I would look at that. And another reason I wouldn't consider it is just because I have seen my grandparents, and they're all getting kind of older, and I just don't know if I could watch other people's families deteriorate and watch how it affects them in my everyday life, and then have to come home to it as well. And then other things I would like to know about a career in long-term care is what is the typical salary of someone in an administrative position in a facility, and what percentage of people that are administrators in the nursing homes and other things like that, what percentage of them have their MHA, and how important would it be to have their MHA. This is pretty much it for my vlog. Thank you.